Hello, everyone. Thank you for joining us for another USDTL Toxtime presentation. I'm your host, Grace Del Tena. We have a special presenter to talk about choosing the best test, an overview of advanced alcohol and other drug testing options. Guida Brown is the principal at Guided by Guida. She has over 30 years of experience working in nonprofit, and more than 15 of those years were working with individuals with substance use disorder. Rita is substance abuse counselor, FAS disorder trainer, and intoxicated driver program assessor certified by the state of Wisconsin, who also serves as a member of the facility at Concordia University, University of Wisconsin Parkside, and Gateway Technical College. So without further ado, I'd like to turn this over to Rita Brown.
Hello. Thank you for joining me on this tax time, choosing the best test. I'm Guida Brown, the principal for Guided by Guida. I first want to talk about why do we test at all? We have different reasons why we would want to test. Initially, we think about workplace testing for pre-employment or accidents or to reduce absenteeism or figure out why absenteeism is happening, or just random tests for those accidents or absenteeism. We have legal sanctions where we're monitoring misuse, typically in the Department of Corrections or in the court system. We have treatment and recovery where we're monitoring non-use, which is going to be the focus of this tax time. And then we have athletics and sports to ensure that there's non-use, particularly of performance-enhancing drugs. So regarding treatment and recovery, unfortunately, we think of the urine test as sort of the gold standard, probably because it's been around the longest. And it was developed in the early 70s, and it has become the go-to test. And it's a great test if you really only want to see what's happening right now. When we're dealing with people who are in treatment and recovery, that's not necessarily the information that we want to look at. We aren't looking for whether or not they're using today. We're looking at whether or not they've used in a period of time, or that's what we want to determine. Regarding treatment and recovery, those of us who work in the substance use disorder field say that we believe that substance use disorders, specifically addiction, is a disease. And unfortunately, oftentimes with testing, we really don't follow that information. My husband had heart surgery and nobody springs tests on him. Nobody calls him and says, you got to rush down here and have a blood test to make sure that your INR, your warfarin test is, your warfarin levels are okay. My sister suffers from diabetes. Same thing. No one throws her in jail because her sugars are out of whack, or no one gives her sanctions of any sort because her insulin levels aren't proper. Instead, they help to figure out what levels they should be at and how to get her to those. Same with my husband. They figure out, is his level of medication proper and how do we get it to the right level? And I understand that we're not dealing with medications necessarily when we're monitoring for treatment and recovery. But the fact remains, if we believe it's a disease, there should be no gotcha in there. And unfortunately, that urine test is very often a gotcha because of the amount of time it can determine somebody's been using. So those are the things that we need to consider. We need to consider the range of testing. What are we testing for? Do we only want to test for alcohol? Do we want to test for other drugs of abuse? Marijuana tends to be an outlier, so we'll talk more about that. But the fact of the matter is we need to know what substance we want to test for, and are we testing for the proper substance? How long do we want to look back? What's the desired window of detection? Again, do we just want to know what they did yesterday? Then we have a lot of tools at hand. If we want to know what they did in a longer period of time, it becomes a little more limited to what we can use. The specimen type. What do we want to deal with? Do we want to use nails? Do we want to use urine? Do we want to use hair? And do we have somebody who can do a blood draw? The level of adulteration potential, how easy is it to adulterate the sample that we're getting? How easy is it to collect? We can all go to the bathroom. We can all can all go to the bathroom. But how easy is it to make sure that we're collecting that in a controlled environment? And then do we need to let them know that there's going to be a collection that's happening? Is there a notice required before we collect the sample? So the best tests, we're looking at blood spot through the nail test. So blood spot can only test for alcohol. It has about a 3-week window of detection. Now, none of these tests are abstinence tests. What they are tests for misuse or tests for use. They don't tell us if somebody didn't use at all. They tell us if somebody used regularly. The blood spot is a pretty close abstinence test looking at a 3-week period, but again, it's not testing for abstinence. Again, it only tests for alcohol, 3 weeks. It's difficult to adulterate that. Somebody pokes their own finger with a lancet. It's hard to adulterate that blood that's coming out. Super easy to collect. They're standing there doing their own testing, and they just poke themselves with a lancet and bleed onto a cardboard treated piece of paper. And the notice for collection is none. We don't have to let anybody know that they're going to have this test coming up. A blood draw, we can test all drugs in a blood draw. We can do a full panel, but that window of detection is only looking back about 1 to 2 days. Again, difficult to adulterate that because we're drawing the blood right out of the body, but it's also difficult to get that. We don't typically have somebody sitting around who's able to do a blood draw. They don't need notice for collection. If they're there, they have blood in their veins, they're able to provide that sample. Urine, we can do a full panel. We can do alcohol and other drugs in a urine cup, but we're only looking at 2 to 3 days of use. So 2 to 3 days before that, what was their level of use? Or were they not using? Were they or were they not using? Not a level. The adulteration potential is super easy. We have a lot of restrictions about what we can do and how we can do that. And so if we're doing a urine test, are we actually in the room observing? And are we actually observing, which really kind of puts some limits on how much we can see. The ease of collection is difficult because of that, because they can be adulterated so easily. People can bring in their own urine from before, they can bring in somebody else's urine. Lots of stories behind adulterating urine collections. And then the notice for collection is required, not necessarily a ton of time. Usually if you just give somebody a bottle of water, they can then provide a sample. But there are some folks who have shy bladders or other reasons why they can't provide a sample right there. So there are some restrictions. An oral swab, we can also do an oral swab for a full panel of drugs, alcohol and other drugs of abuse. Again, that window of detection is pretty short, 1 to 2 days. So we know within the last 2 days whether or not somebody was using substances. Very hard to adulterate that because of the process, just swabbing somebody's mouth. Collection is easy, and again, no notice is required for collection. Sweat patch, we can do again a full panel of drugs, alcohol and other drugs of abuse. We're looking back about 7 to 10 days, and that's only when a person is wearing the patch and about 1 day before that. So 7 to 10 days while that patch is on. The longest the patch can stand is about 14 days. The typical is about 7. It is difficult to adulterate that. The ease of collection is moderate. It has to be placed and removed by somebody who's skilled in placing and removing that sweat patch. So it can't just be sent to somebody and have them do it themselves. The notice of collection is no, we don't have to tell anybody. They walk in, you can put a patch on. Hair and nail, I'm going to spend some time on hair and nail. So we can test both of those samples for alcohol and other drugs of abuse. In hair, it's about a 3-month window of detection for both hair and other drugs of abuse. The adulteration potential is moderate. It's people treat their hair, people curl their hair, people shave their hair, and they get it all off, so it's not accessible at all. The ease of collection, if you have a sample, the ease of collection for hair is easy. And we do have to let them know that they're going to have a test because it could be that they've treated their hair, now it has to grow out, so it's not treated or not permed or colored. Could have to grow out, period. So we're not, scalping somebody down to the scalp, the skin. And when we look at hair and nail, that 3 months is for alcohol and other drugs of abuse, with the exception of marijuana. Marijuana on all of these tests is an outlier. It can stay in the body much longer than other substances will stay in the body. And so that 3 months for hair and that 6 months for nail is on the short end, specifically for marijuana. So for nail, again, we can look at alcohol or other drugs of abuse. 3 to 6 months, it's about 3 months for alcohol and about 6 months for drugs of abuse, again, with the exception of marijuana, especially if somebody is a regular chronic marijuana user. The adulteration potential is difficult. We know that they're getting their nails because we are watching them put their nails in front of us into a bag. So we know it's only their fingernails. The ease of collection is easy enough once they have those fingernails, and the growth level is about the length on all 10 fingernails of the ridge of a quarter. So you put a quarter flat on the top of somebody's fingernails, the top of somebody's fingers. If the fingernail comes up over that, generally on all 10 fingers, you'll have enough nail. Does it have to be all 10 fingers? No. People who don't have fingers or they had fingernails and they broke off. So it doesn't have to be all 10, but it has to be a substantial amount of growth. And so the collection is easy. The notice for collection could be a little bit more. Gel fingernails, gel nail polish, fake fingernails. They have to get those off and then the fingernail has to grow. So to me, I prefer the nail test to the hair test because of the inability to adulterate that. And nails are the same across the board. Everybody's fingernails are the same, whereas the hair is different across genders and across races. It doesn't hold the substance the same level. So that 6 month window in a nail seems to be just a better, more reliable sample in the work that I've done. The cost of the best test. Now, I just want to give a little caveat here. This is not scientific. I Googled how much does a test cost, and then I did the math on it. And so how I did the math was, if we're looking at a blood spot and it's only testing for 3 weeks at a time, test costs about $150. Over the course of a year, looking at 3 weeks, it's going to be $2,600. A blood draw, both the blood draw and the oral swab are cost prohibitive, not because that initial test is that expensive, it's about $150, so the same as many of these tests, but because of that window of detection. That window of detection is so short that if you wanted reliable information about what somebody is doing across a year, you'd have to do those tests every 2 days. Now, I get it, we're not doing that. But who's the population you're trying to monitor? If you're trying to monitor a workplace, then that might be fine. If you're trying to monitor a person who is in need of recovery or who is in recovery, then that is prohibitive. I get it. We're not doing it. We're not doing it every 1 to 2 days. We're doing it when we think it needs to happen, or when we have the availability of maybe a person who's going to do that test, or when there's a reason that we should do it, or when it's random. But again, if we're treating an addiction, if we're treating a disease, then random tests aren't really treating that disease. Saying that somebody should just come in whenever isn't treating the disease. And so the idea behind these tests is figuring out who your population is, what you're trying to monitor, and doing the best for them. So a blood draw and the oral swab while initially they seem like they're good tests, when you're only looking at 1 to 2 days, it's probably not going to be great information, again, depending upon who your population is and what information you're trying to gather. That urine test, it's inexpensive, and that's why it's our default very often. It's a cheap test. But when you're only looking at 2 to 3 days, it's not really giving us the information that we want when we're looking at treatment and recovery. The sweat patch, same information, $5,000 a year for somebody to wear a sweat patch every single day, that might not be great, reliable, effective gathering of the information. Those hair and nail tests can be they're far reaching. That window of detection looks back a long time. So yeah, the tests are more expensive, absolutely. But the idea behind them, if we're treating substance use disorders, if we're helping somebody become abstinent, helping somebody get into recovery, or if we're monitoring that recovery, those hair and nail tests are, to me, far and above anything we're getting. The other piece of this is we have to remember what we want to know. What kind of information are we trying to gather? If we test somebody for alcohol only and they're using another substance, that's not really helpful. If we're doing a urine test, oftentimes people can white knuckle it for 2 to 3 days. We're not getting the information that we're looking for if we're springing tests on people, or even if we're announcing them that on Monday you have to have a urine test. The stories I could tell about people cheating the tests, figuring out ways around them, using somebody else's sample, using over a period of time and then stopping, knowing when they have to stop because they have to go and provide a sample. Breathalyzers are notoriously abused because they're only testing for alcohol. And this is both the ignition interlock in the car, as well as a monitoring system that says, you have to come in and blow at this time. If I'm not supposed, because again, these are not abstinence tests. There are no abstinence tests. I can just not use for X period of time. And if you think I'm an expert on these tests, you have no idea what people who have to submit to these tests know about them. So there's really, what's really important to know is who we're testing. What are we testing for? What information do we want to know for this person? And how far back do we want to look? Again, if we only care about whether or not somebody used yesterday, that urine test is golden. It is. But if we're trying to help somebody stay in recovery and not penalize them for a disease that we say we believe they have, then we have to choose better tests. That's it. I look forward to your questions. And if anything comes up down the road, please do feel free to email me. Thank you.
Subscribe to our channel and visit our website for more information.